So with this exercise, what we're going to do is work on the posterior tilt through the pelvis. So a lot of people have this anterior tilt. So if you bring the pelvis forward and stick the bum out, this is called an anterior tilt through the pelvis, and you'll see quite an increased curve through my lower back here. If we tuck the bum under, this is called a posterior tilt, and it flattens the lower back. So what we want to do is not aim on, bringing the pelvis into one position or the other, but to allow the body to experience both movements. So if someone is very much in this anterior tilt, what we want them to be able to do is experience the posterior tilt. So the spine there gets an extension and a flexion through both of those. We've worked with some of that movement in some of the exercises we've done before. And this, what we're going to just do is use the muscles down the back of the legs, the hamstrings, to try and increase that posterior tilt. So I'm going to show you this exercise from the side, because it makes a lot more sense that way. So we're going to start with the right leg. What I want you to do is to put your right heel, this outside part of the heel, onto the floor and toes flex up towards you. Then all I want you to start doing is to send the bum backwards. So we want the pelvis to come behind us and slightly off to the right hand side, so that you're putting weight into the outside of that right heel. Just do that a few times to get used to it. And then what we're going to add in is the flexion, because at the moment my pelvis is staying pretty static, where I'm keeping my upper body fixed. So I'm going to take the left hand, so the opposite hand to the foot. I'm just going to reach it down towards the right toe. So what you can see there is now that I'm bringing my spine into a flexion, so there's a curve here. And what that means is the pelvis is coming into a posterior tilt. So just going to do that a few more times. So bum back, reach towards that right toe. So you're getting a bit of rotation through the spine as well. You can keep that other leg a little bit bent. It's quite hard to do with a straight knee. I'll show you this on the other side. So left foot onto the outside of the heel, leg straight, back leg slightly bent. Start by just sending the pelvis backwards. So backwards and over to the left hand side slightly. Once you feel comfortable with that movement, then what you can do is take the right hand, so the opposite hand, and reach towards the right toe. So for me, this way is a little bit stiffer. We're just going to reach down and try and create some flexion through the back if you can. So you can look towards that toe. It does really help in increasing some of the flexion through the spine. And again, 10 or 12 repetitions, that really helps to mobilise this whole area in the back. So as long as you've not got any pain on bending forwards, this is a really nice exercise to practice throughout the day.